Hey guys, Dr. Davin Lim, board certified laser dermatologist. Today's topic we'll be talking about eye rejuvenation and how I perform this procedure. Now, people think eye rejuvenation is just rejuvenating this area here, but it's not. It's actually, I see the eye as the entire area, which starts from your mid-cheek area that extends all the way up to your temples. And you'll see in this video why it's so important that for eye rejuvenation, one has to be an expert in both lasers, fillers, as well as surgery and energy devices to get the best result. So when we're talking about eye rejuvenation, we're talking about three things universally, and that's skin texture, tone, and volume. So the skin texture is basically whether you've got any brown spots around that area or whether you've got some fine wrinkles that we can address. So that's the easy bit, the skin texture. Skin tone, we're talking about how good your skin is when it comes to laxity. So whether your brows are hooded or heavy, or your eyelids are hooded or heavy. So there's a difference there, right? So that's a skin tone. And then volume, which is, I think, the most underrated thing in regards to eye rejuvenation, because volumization of strategic areas around your eye area, especially with your cheeks, your eye bags, even your brows, can create an amazing effect with no downtime and basically very little risk if you know what you're doing. So watch this video and I'll go through eye rejuvenation for you. Thanks for that.
What's new for 2017 and beyond? It's fillers for eye rejuvenation. Fillers can do amazing things because it can rejuvenate the eyebrow, it can elevate the eyebrow and the eye lid position and open up the eyes, reduce wrinkles around the area, and they do this with minimal, if not zero downtime. So around the eye area, I often like using a cannula. A cannula is basically a blunt needle and we can be very precise in the delivery of where we place the fillers. I also use needles in certain areas, especially the temple area, because remember the temple is part of the eye area. If we can rejuvenate the temple area and revolumize the temple area, you elevate the eyebrow. So the temple area is part of the eye complex. I treat it as part of the eye complex, and by getting everything in harmony, it looks much better. So here I am rejuvenating the temple area. So you can see me filling shortly.
Okay, so the first technique I'm using is just a simple needle technique. So basically I'm filling up her temples. By filling up the temples and displacing the lost volume over there, I'm actually lifting up her eyebrows. So basically it's an eye-opening exercise of filling. So I'm very careful, I'm down to bone. It looks painful, but it actually is very comfortable. So it's a very, very slow technique. And I'm using about 1.5 mil in her situation in each temple. As one ages, we need more volume. So here you can see me correcting the other side, and I basically check for symmetry and make sure both sides are equal. So that's temple filling using a needle technique. So here I am using a little 25 gauge needle to introduce what's known as a micro cannula. I'm using a 27 gauge cannula. It's got to be safe in this area. There's a lot of blood vessels. It is actually not a needle, so you can see when I do this, it's not sharp. So the theory is that it pushes away the blood vessels, but it still gets me to the point of where I want to go. So it's a safer technique compared to obviously using a needle, and you've got to be in a good plane as well. So we know that the supratrochlear and supraorbital arteries run deep, so I'm in the mid layer, mid to superficial layer. So this is an advanced procedure. I'm using Volift, as the name suggests, it actually lifts. And what I'm doing here is actually placing more volume in the brow to actually open up her eyes. This will give her an amazing amount of eye rejuvenation that looks natural. So I believe in this patient, as in Emily, the biggest change I can make is to open up her eyes. So this is what I call freestyle filling, basically finding areas which I find that will benefit from a little bit of filler. So I'm just correcting her brows now, and you can see the before and after results very shortly. So it's been, I think, about 2 weeks since your last filler, yeah?
Yeah.
What have you noticed most? What's the biggest difference, you think?
Probably more opening of my eyes.
Yeah?
And definitely cheeks.
Cheeks, yeah. So in all, I think I put 5 mils of filler in you, didn't I?
Yeah.
Yeah, that's quite a fair bit for someone in their 20s.
But overall, nice balance. You notice,
Yeah, very natural. No one really knows.
Excellent. Yep. And your wedding's in
8 days.
8 days. Cool. Okay, let's keep it as that. The last thing I ever do is any fillers or Botox anywhere near a wedding. So I always call it at the 2 week mark I stop. But I think you look natural. I've got your temples up. I've got your brows. Do you notice you've got more volume in your brows? Yeah? Definitely more volume in your brows. We've lost that peanut shape, or a peanut head. Yeah, I mean, ideally I would have loved to have done your lips, but hey, there's no way I'm going to do that now coming on to your wedding. But yeah, overall, everyone's happy. Cool, thanks for that.
So here are the before and after results. You can see it's a very nice, subtle look. First of all, her chin crease is decreased slightly. You can see her cheeks are slightly fuller and her eyebrows are in a better position.
Remember what I said where the eye starts at the mid-cheek area? This is what I mean. This is called foundation filling. So I'm not treating the eye area itself, but the cheek area, because this gives us foundations. So in this situation, I'm using a cannula. I'm also combining this with laser at a different date to actually help improve skin texture and skin tone. And this is what we have before and after, a marked improvement. But remember, we're treating the whole area and not just the eye bags itself to give the best improvement. Once again, this is dermal fillers, just this one session, no lasers were involved, no downtime. That's the before and the after, so you can see a marked improvement with dermal fillers. Fractional energy devices work in the same way, basically delivering portions of laser beams which can cover different areas of skin, so they heal up quicker. Now, one of the best known fractionated lasers is the brand name of Fraxel. So Fraxel comes in 3 different wavelengths, the 1550 Fraxel and the CO2 Fraxel. Of all the different types of Fraxels, the one that's going to give you the best skin tightening is this one here, which is known as the Fraxel Repair, or CO2. So in this case, we can cover up to 60% of skin using the CO2 laser. Another laser which I like to use is called the CO2 Core. This is made by Syneron Candela, and this is more powerful than the Fraxel, but I've replaced this recently with something called a U laser, which is basically a combination of different Fraxel lasers with more power. So the advantage of using freehand laser is that I can basically dial in the amount of coverage, which means I can control the healing time and also the outcome. So the higher the density, the longer the healing up time, but the better the results. So that's using what's known as a fractionated CO2 laser. I do believe that's better than the erbium. So what are before and afters like? Here's typical before. This is after one treatment and one treatment only using a CO2 fractional laser at a high density. So it's a 6-day recovery. This is combining both 1927 Fraxel and the CO2. She had one treatment only. So fully ablative lasers. I use both an erbium laser and the CO2. Fully ablative lasers means it takes the entire portion of the skin off. So it doesn't treat portions of the skin, but it takes the entire layer off. And I use this for extreme sun damage. Now, the problem with the CO2 or erbium is that it does take a long time for it to heal. So this is the typical healing up process after 10 days. After 10 days, the skin is still raw, but we use a heal light, and that can actually help speed up the recovery time, decrease the redness, but still it's not for the faint-hearted because it does take a long time for it to heal. So here we are. This is healing at week 4. So you can see there's a marked improvement in the skin tightening, especially with wrinkles, but the skin is still red, and the redness often persists all the way up to, realistically, up to 2 to 3 months, and sometimes even further. So that's a CO2 laser. What are the before and afters? This lady presented to me with a marked amount of sun damage. My initial assessment was, look, it's a surgical procedure, but she insisted no surgery, but just wanted some laser. So this is after a combination of erbium and CO2, one treatment only. So you can see the marked difference in the eyes before and after with just one treatment of combination treatments. And this is my favorite as well with the erbium laser, coupled with a fractional CO2, the before and afters. And this is a very, very old slide of a erbium laser, fully ablative. I think this is my patient about 10 years ago. And she's still doing well now, so it's actually lasted about a decade. Surgical methods are very important because surgery can only fix aging skin where there's marked laxity. So you can see there's two types of hooding. So you have the hooding of the eyelids, but you can also have brow hooding as well. So what we do is the pinch test. So if I can pinch it up, for hooding like this, realistically, lasers can help, but I prefer surgery. And the surgery is extremely easy. It's basically an elliptical incision or excision. I don't remove any fat pad. I basically just remove the skin. It takes me about an hour to do, and the recovery time is about 7 days or so. So you have stitches. So this is before lower lid blepharoplasty, coupled with upper laser blepharoplasty. So this is before with a lower lid surgery, and this is after lower lid surgery. So you can see a marked improvement with surgery. PRP, well, I started using PRP many years ago. PRP can help. I prefer, seriously, I do prefer to actually combine that with Infinity RF and an over and under method. But this is me showing PRP using a cannula method to treat under the eye area. You can see my left finger is supporting the area on the orbital bone so that I don't actually penetrate into the eyeball. So guys, there you have it, this eye rejuvenation. Like I said, you need to be an expert in all these areas. Everything from surgery and how to assess a good surgical candidate, all the way through lasers using different type of energy devices, and most importantly, filling, because I think that's the future of eye rejuvenation. Basically, we want a low downtime procedure which gives results. But as you can see with the patient demographics of which I get, I have to use all different methods, because certainly for someone with really crepey eyelids and wrinkles, fill is not a good option, and the lasers behind me is the treatment of choice. But for the majority of people in the 20s all the way up to, I think, about 40, in the late 40s, fillers can achieve an amazing result, but once again with very little downtime. Thanks for watching, guys. And if you like, please subscribe. I do one video every Saturday morning, Brisbane time. I'm also on Instagram, so if you're bored, you can follow me on that. A couple of new videos every week, and a couple of pics every week as well. Till next Saturday, catch you later. Bye.